The Overlay mattress is a dynamic pressure therapy overlay, and it's designed to be placed on the existing mattress that's in situ on the bed frame. It has a maximum user weight of 180 kilograms, which is 28 stone, and this does include any bedding or accessories that are used on the mattress. It's suitable for up to very high risk patients. However, always ensure that monitoring and repositioning is carried out as per the individual plan of care. A risk assessment must be performed to ensure the suitability of the patient and the contraindications, for example, unstable spinal injuries. For those patients of a very low weight, typically less than 40 kilograms, and a physical size of less than 146 centimetres, clinical judgment is to be used to determine suitability. Support platforms used with the mattress can vary greatly depending on the specific healthcare setting. So it is the responsibility of the prescriber to carry out the necessary risk assessment to ensure suitable product compatibility and the safety of the patient. Refer to your local policy and guidance on equipment selection and to the full user manual instructions and guidance prior to using the product in relation to safe use. To set up the overlay, simply place it onto the existing mattress already onto the bed. Open up, ensuring that the tube connector is at the foot end and the feet symbol are facing up. Attach the 4 corner straps to the base mattress, ensuring they're not twisted and are positioned securely. Then simply place the chosen pump unit, the Theia or the Eros, onto the foot end of the bed, and using the quick connector, attach the mattress to the pump unit. The CPR tag is located at the foot end of the mattress on the left hand side. As it's a CPR tag, it's important that on setup you ensure that the ports are connected fully into the tubing so that when the mattress is connected to the pump unit, it will inflate. Once the pump unit is switched on at the mains outlet and switched on the unit itself, the mattress will start to inflate. The mattress will inflate over a 40-minute time period. However, to optimise that, you can turn the pressure settings on the pump units up to maximum while it's inflating, and once the mattress is fully inflated, then you turn the dial to the correct setting to meet clinical requirements. The overlay has a green top cover, which is multi-way stretch, it's vapor permeable and it's waterproof, and it also has a navy nylon base. Ultra Fresh, which is an antimicrobial agent, is fully encapsulated in the cover to help control microbial deterioration and to help extend the life of the cover. The cover clearly identifies the mattress type, which in this case is an overlay, the maximum user weight of 180 kilograms, and at the bottom end, the care and cleaning instructions are clearly identified, with the feet identifier for placement. The compatible pump units are identified here, and then we have a zip identifier so we know where the zip is to be found on the mattress. The overlay mattress has a 360-degree zip, which means that the green top cover can be replaced if required. High-frequency welded seams fully conceals the zip, which reduces the possibility of fluid ingress and aids infection control. The overlay mattress has a white inner substrate, which makes it very easy to identify any ingress or staining to the top cover during auditing procedures, which means that the top cover has been compromised. The overlay mattress comprises of 17 individual cells. The top 3 cells remain static at all times, so that reduces any feeling of nausea or motion sickness that the person using the mattress may experience otherwise. The remaining 14 cells operate in a 2-in-1 dynamic movement over a 12-minute cycle. This means that at any one time, 50% of the patient's body is supported, whilst the other 50% experiences pressure relief. For rapid deflation, simply pull the CPR tag firmly in a downward movement and air will be released from the mattress. And just to note, it's important that any bed sheets applied to the mattress are fitted loosely to reduce any hammocking effect, and also to consider that any additional layers that are placed between the patient and the mattress itself, such as some incontinence products, could impact on the pressure relief provided. The umbilical cord connector includes a transport cap. which means the mattress will remain inflated for up to 8 hours to ensure the support surface provides pressure redistribution in power outages or when transport is required.